This is Average Joe PT, and on this episode, we're going to talk about neck pain and radiating symptoms coming from the neck, going down into the hand or the shoulder area. And you're kind of wondering, oh my gosh, should I go to the doctor or will this go away? So stay tuned. So when you're having neck pain that goes down into your hand, and the first thing you notice is you have some hand numbness, there's some basic things we need to talk about first. One of them is just the anatomy of this. Now, where are the symptoms coming from? They're coming from the top of your neck area and traveling down into your shoulder blade and down into your hand because one or a couple of those nerves are inflamed. Now, when we talk about inflammation around those nerves, there are usually some swelling that goes on with that, as well as some damage. So that damage can be healed over a period of time as long as the trick is that you're not continuing to aggravate what's causing the symptoms in the first place. Now, some of those symptoms could be something as innocuous as just looking down at your phone too long, or maybe swinging, or some sort of activity that might be using your shoulders or arms a lot, and that might be causing some aggravation going into your neck and getting those nerves inflamed. The toughest part is getting those nerves to calm down. Now, as long as we're not talking about a herniation or rupture of that particular neck, which means, I'll leave a tag up there and I go over all types of different treatment techniques of what to look for when you're having a disc herniation or rupture. And so you can go ahead and look at that after this video. But this video, we're talking about specifically just some inflammation and swelling around those nerves caused by some sort of repetitive activity, or maybe a short-term trauma, car accident, maybe a fall, something that it was just atraumatic, which means it happened once or didn't happen, or you're just thinking about, oh my gosh, did that do something or didn't it? It's been a few weeks since I've had that injury or that accident. And so, yes, it can take instantly, all of a sudden you have nerve symptoms, or it can take time, depending on the type of trauma that's occurring in the first place. If it's a repetitive trauma, it's more than likely going to come onto you slowly. You're going to wake up one day with maybe some funny symptoms, maybe in your pinky or your ring finger or your thumb. You're like, you think the first thing you're going to think is carpal tunnel syndrome. And the reality is I'll leave a link up there. I have a video on carpal tunnel. It's an older one, but kind of gives you the basics. If you think you have carpal tunnel syndrome, what you need to look out for. More times than not, it's not carpal tunnel syndrome. It's probably coming from your neck. Now, there is times that it could coming from your elbow, but more times than not, it's probably coming from your neck. If you notice you're having difficulty moving your neck up, down, or in or out, in combination with some sort of funny symptoms, numbness, burning, kind of weird loss of sensation in your hand, then yes, it's probably coming from your neck. Now, there's specific nerves in our neck that are related to the fingers in our hands. Now, the pinky is basically that last neck joint nerve area here causing those symptoms. If we're talking about your thumb or your pointer finger, that's up a little bit, and that's our classic C5, C6 nerve that's getting inflamed. So as you can see, depending on where your symptoms are in your hand, gives us a really good idea where it's affecting in your neck. Treatment techniques are very important when it comes to this nerve problem, and it's extra important if you do that early. So when you're first starting to feel the symptoms in the hand, that's when you start to bring up the red flag and say, uh-oh, what have I done wrong? Have I slept wrong? Have I lifted something wrong? Have I obviously, the car accident or, fallen downstairs or something has affected my neck to give me the symptoms in my hand. Treatment number one is icing. For 72 hours, you want to ice your neck. Don't be icing your hand because your symptoms are coming from your neck. You want to ice that neck 15 to 20 minutes, 4 or 5 times a day. You should hopefully notice after at least half a day of maybe icing it and decreasing looking down and aggravating those neck muscles in that joint, you should feel that your symptoms start to feel a little bit better. It's not as intense of numbness or burning. That's giving you a good sign that you're on the right track. Treatment number 2, maybe take some anti-inflammatories. Now, obviously, I'm not a physician, but if you've taken ibuprofen or some sort of non-steroidal anti-inflammatory in the past, you might want to take that to try and reduce inflammation that we talked about that's probably causing your nerve to get irritated in the first place. Treatment number 3, rest that neck. So stay away from, like I said, looking down, lifting, pushing, pulling, and carrying for at least 3 days to try and get those symptoms to calm down. Those are the 3 basic treatment techniques that you want to do. Things you want to avoid, number 4 is no lifting. Stay away from stretching. You're not doing any of these stretches or anything like that you might see on the internet when you start having hand symptoms. You want to stay away from that. You got to give this neck, joint, disc area some time to calm back down with that inflammation that's going on there that's causing your symptoms in the first place. The number 5 that you don't want to do is do any of this overhead kind of activity. Some people will try maybe doing some joint cracking or snapping. Stay away from that. It's going to cause more inflammation than reducing it. Right now, we want to reduce those inflammation that's causing those nerves to begin with. So those are some do's and some don'ts when it comes to this type of problem. So stick around. I got a little bit more. All right. So if you guys have any question at all, I want you to go ahead and leave a comment down below. I try and bring content once or twice a week. Hopefully you guys will subscribe. If not, thank you for coming anyways. Hopefully it gave you some good information. Until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.